My name is Dr. Ryan Ting, and I'm an orthopedic sports medicine director, sports performance specialist, and expert in the areas of sports rehabilitation and sports performance training in terms of controlled movement and biomechanics. I'm also a former two-time NCAA national champion, and I've been with GRIPBELL for over 4 years as a GRIPBELL practitioner and as the director of video content lead. I've also been able to have the opportunity to work with a multitude of different backgrounds and athletes and patients from all different ages who've been able to engage with GRIPBELL. So I've really seen the clinical and end user experience in terms of their feedback and what I've seen in terms of their functionality and versatility when engaging with weighted objects that are very unique in terms of their manipulation of different exercises that they can use and utilize these tools with. I could start with the different athletes that I trained with the GRIPBELLs and really show and emphasize the functionality and the versatility of how beneficial they are for training purposes in terms of balance control, stability, and strengthening and conditioning. Baseball players, we use them for pitchers and batters to really work their upper resistance training to alleviate the shoulders and the elbows and the wrists, chronic inflammation by using more truncal and putting more emphasis on truncal and core rotation in their hips and their core. That really alleviates the pressure on the elbow and the shoulders for baseball players. For our gymnasts, ballerinas, and our dancers, we increase their functionality off of one foot and their balance, especially in terms of the balance beam by placing these GRIPBELLs on their feet or their hands and really keep getting their body in different postures and exposing them to different weight distributions so that they can work on their balance control. Our MMA fighters, mixed martial arts artists, and our motocross riders, we utilize different hand grip, isometric engagement in terms of their hand placement, in terms of steering. Also with grappling and wrestling and fighters, we really work the upper body in terms of their intrinsic muscles of the hands, wrists, and flexors and extensors of their forearms. Basketball players and football players and soccer players, we utilize them for movement control, core stability work, also strength and conditioning. We can utilize them for weights and building those muscle groups to really target and engage those isometric engagement as well as resistance training. Yoga athletes, yoga instructors, we're able to place them even on their, not only their hands, but their feet to really work balance controls and those really postural movements to really lock in and strike those poses. Cardiovascular athletes, such as high intensity cardiovascular athletes, such as runners and swimmers, we're able to put them in their hands as well as their feet, land workouts, and also more specifically in aquatic training. They're able to utilize the GRIPBELLs in the pool, which makes them very functional when you're doing weighted objects and performing exercises in the pool in a safe manner. Physical education, we're able to utilize them in PE classes, in elementary schools, because they're so safe and lightweight that any age group can utilize them and incorporate them in their physical activities, which makes them very universal and very functional as well. In our patient population group, we're able to utilize them for our medical protocols in terms of rehab, in terms of range of motion and stability and strengthening to really recondition all those muscle groups that have atrophied, especially post-surgically. They're very, GRIPBELLs are very engaging, very specific in terms of movement control, and it really locks you in terms of the isometric engagement as well. So I want to keep stressing that and pointing that out. But no matter what age group, no matter what occupations you're in or what field, you do not have to be an athlete to use these weighted objects. GRIPBELLs are essentially a two-in-one. They're more versatile than a kettlebell or a dumbbell because you can manipulate and strategically place your hand grip in different positions that are very specific, so you can manipulate the weight distribution and the torque to either increase or decrease that torque distribution for that change in weight. So it's very advantageous for that. In the same say 10-pound weight, you can increase the weight just by the position of your grip. So that's super important when understanding the grip bell and the different hand placement with all of this as well. I think they're very fun, they're engaging, they're very efficient, and they're very safe to use, and that's why it makes it for a very universal weightlifting and fitness tool that every gym, every HIIT class, every elementary PE class should be able to use and incorporate in the future. I want to thank you for your time and thank you for listening to this message.